How is it going, everybody? What are blocked tubes? Okay. What are blocked tubes? Does having blocked tubes mean that you can't have a child? What really causes blocked tubes? In this video would be having a conversation around blocked tubes, and you would want to stick around till we are done with this. So let's go to our diagram to really see what really happens for a normal pregnancy to take place. So for normal pregnancy to take place, this is just the woman's reproductive organ, okay? So the vagina is here, the down part here is the vagina. This is the cervix. The cervix is the mouth of the uterus, okay? This is the uterus or the womb, like we call it the womb, okay? Or the uterus. Now the uterus has two hands, this one hand, the other hand, and these are the fallopian tubes, okay? So this is one fallopian tube, and this is another fallopian tube, okay? And these are the ovaries. This is the ovary 1, ovary 2, okay? Everyone has this. However, some people don't have fallopian tubes. Some people, like, it's just congenital, okay? But this diagram, for normal pregnancy to take place, when the sperms are released through the vagina, they pass here, come, and the egg is also released. You know, the egg is released from here, okay? Passes through this place, and the egg and the sperm meet around this part of the fallopian tube. When they meet here, fertilization takes place. For about 2 to 3 days time, the egg, which is fertilized, okay, is able to or should move to this place, okay, which is the uterus. Sometimes it's not able to move into the uterus, which will end up causing ectopic. But if it's able to move into the uterus, which is the right thing, it ends up embedding itself into the uterus, and that's normal pregnancy. That's the beginning of pregnancy, okay? So the tubes have a part to play, the ovaries have parts to play, the cervix is the pathway within which the sperms pass through, okay, through the vagina, through the cervix, into the uterus to meet the sperm and the egg at the fallopian tube or in the fallopian tubes, okay? Now, what really could happen if the fallopian tube is blocked? Let's look at our next diagram. If the fallopian tube is blocked, so for this diagram, this is a blocked fallopian tube, okay? A lot of things can cause it, which we'll talk about today. So if this is blocked, it means that the egg is released all right, but if the sperms are also released through this place, they pass here, some might not be able to go through. The ones that are able to even maneuver and find their way through could, even when they reach here and fertilization takes place, they cannot come back, okay, because this place is blocked. So it could end up causing ectopic gestation because the tube is blocked, okay? So if one tube is blocked, don't forget you have two tubes, okay? The other would work and should work. However, if the two tubes are blocked, then all hope is not lost, okay? There are a lot of things that could be done to help you. That's the more reason why you shouldn't miss our next video, because we'll talk more about options for someone that has a blocked tube, okay? Let me just give a little gist on some of the things that can cause blocked tubes, okay? Some people naturally were born with blocked tubes. Some people don't even have tubes. Some people could get blocked tubes as a result of infections, okay? Infections, if abortions that are not done well can cause infections, which could result in blocked tubes. And a lot of other things which you shouldn't miss, because it will be talked about more in the next video that I'll be posting. I trust you've learned something from this video. Please be encouraged, even if you have a blocked tube, be encouraged and stay connected even as we watch the next video. And if you have questions, please ask. Thank you so much for watching. Keep watching and stay blessed. I am Midwife Adzo. Do enjoy the rest of the time. Bye-bye.